Now, around £1 billion of benefits are going unclaimed every year in Scotland. That's according to an organisation that helps people get what they're owed. Policy in Practice says nearly 500,000 households in Scotland are missing out on benefits.
Now that adds up to more than 1 million missed claims every year. Now they say that nearly £570 million of missed benefits are attendance allowance. That's a benefit available to pension-aged people who need extra help in daily life. Now, according to Policy in Practice, claiming that benefit can increase a pensioner's annual income by nearly a third. Well, what's joining us now is Deven Ghelani. He's Director of Policy in Practice at the company behind the figures, and they're partly funded by local authorities and say they help make government policy simple to understand. Tell me, Deven, why you think people are not claiming these kinds of benefits?
Hi Graham, thanks for having us on and for covering this piece, because I think one of the main reasons people don't access the support they're eligible for is they don't know about it. And hopefully packages like this one is one way to raise awareness of the amount that goes unclaimed. And actually, I'd argue the number's bigger. So we estimated in Scotland £1.3 billion worth of rights-based benefits goes unclaimed. But when you factor in things like support for people with disabilities or discretionary funds or social tariffs that are also available to people, the number rises to over £2 billion. So one of the reasons is awareness. People don't know about it. I think a second reason is often that the process for claiming can be quite complicated, and that's for each individual benefit. So if people are eligible for 4, 5, 6 different types of support, they have to go and fill out 4, 5, 6 different forms. If they're struggling with the first one, it's going to be hard for them to follow through on the other applications. And the final reason is people are sometimes ashamed of claiming benefits, and I really don't think that they should be. You know, this is support that is there for you. And if you think about, I know a bit about the package that's coming next and the support that's going to help people claim attendance allowance. You know, if you think about that, that's helping people to live healthier lives for longer. So it means that they stay active for longer and less of a burden. But when they do need care, it also means that money is there to help pay for that care, which reduces the financial pressure on local authorities. So one way to think about these benefits is really as an investment in people to be able to take the next steps.
What do you think government could do about it? Because weren't they trying to streamline benefits?
Yeah, so they have been trying to. So Universal Credit tries to bring a range of different working age benefits together into one. And that has, you know, you can certainly argue that helped during the pandemic because people only had to apply for go to one place to access support for housing, support for children, as well as other support. But I think the challenge has been in a cost of living crisis. You've seen a whole range of other types of support pop up. So now you can get support potentially from water companies, energy companies, broadband companies. Councils have something called the Household Support Fund, which they can administer. There's other crisis support out there. And it just goes to show how complicated the system has become. And you know, it's become more of a challenge in some respects from when I first started trying to simplify it to keep it under control.
OK, Deven Ghelani from Policy in Practice, thank you.
Well, Angela McHugh and Jake McLeod have both had training on how to claim attendance allowance. That is the benefit available to people who need extra help in daily life that can raise a pensioner's income by nearly a third. Welcome both. Jake, just explain, what is this training and how does it come about?
Well, quite clearly, we're a branch of 500 people, all retired members. And we'll have over 1,000 people.
And that's just to be clear, that's Trade Union
Yes.
Unite, yeah.
And we've over 1,000 people that are over 80. Now, we had a lad went into hospital. Let's just have to explain how we got where we got to.
Do.
He went into hospital and he was visited by a friend of his who just happened to be a welfare rights operative. And they got talking, and Sammy was in getting a catheter fitted. He was getting stuff for his cancer. And he was told, I'll come and visit you after this and we'll see how we can get on getting you. Now that happened and he was very successful and he won his case. He came and visited us and says, here, there's a chance here for the union to get involved. And we took it to the branch and everybody was happy about this. So we decided that we'd do what we call a pilot scheme, right? And we've had 35 people have went through to see if they can get attendance allowance.
And is that just in terms of filling in the forms or just being able to ask the right questions?
That's filling in the forms by a welfare rights operative, right? And every one of them was successful. Now, we realised we couldn't use the offices of welfare rights all the time. We had to start doing something for ourselves. So we've had training up to a point. We were very lucky that one of the lads that's on our branch, he was a plumber, went to London, became a welfare rights operative, and came back and got a job with the union. So he's nearly there. He's getting training and he'll be spot on. Well, one or two people going out with welfare rights officers at the moment and practising how they do it.
Yeah.
So that's a big bonus for us, right?
I guess it's just sort of giving people the confidence to be able to do it and the awareness. Angela, what kind of difference does it make to people, just not only knowing that they're eligible for this, but then in terms of the actual payment itself?
It can make an enormous difference. I mean, I actually got it and I got the higher rate, which works out at £101 per week and has gone up in April to £108 per week. So that comes to over £5,000 a year. And for me, it made a difference, and I was very sceptical because a friend of mine had been saying for years, you should try for that. I said, don't be ridiculous, I've got 2 pensions, I'll not get it. And, you know, you need to be bedbound, I'll not get it. And the form is horrific because I had got the form and threw it in a drawer and left it. But anyway, my friend, David's mentioned him, he kept on at me, so I said, OK, I'll get a form. Got a form, expecting nothing, got help from our welfare rights friend to fill it in, and I couldn't believe it, I got the higher rate. The difference that's made is, for instance, I've got some health issues, but the main one would be rheumatoid arthritis. And look, last year, before I got it, in the winter, it was quite a cold winter last year, and I live in a house, live in my own, and it's an old house, takes an awful lot to heat it, so you don't heat the whole house or anything like that. You know, and for instance, if I was in the living room at night and maybe quite a lot during the day, I would heat that, and sometimes I would sleep on the couch because I didn't want to start heating the bedroom. Things like that, there was never heating on in the whole house. You went about like that, loads of clothes, and it's actually not good for you. And I could feel it was, you know, hurting me, the cold. I was never felt so cold. Anyway, this year, I can put the heating on without having to worry myself sick about it. Other things like laundry, you know, bed clothes, heavy washings, different things like that. I can send them out to a laundry to get done. Just a million different things. Like travel, actually going out. Sometimes you're not feeling at your best to actually, I don't drive or anything like that, to actually go and get a bus and go somewhere. So you don't go out, and that could lead to mental health problems. That you can actually get transport. You're not always having to ask relatives, friends, because you really don't like doing that, because you don't like admitting.
Absolutely, and I think I was going to say that sometimes a bit of a stigma, especially, you know, from people that wouldn't necessarily want to claim benefits.
But it's a marvellous thing that's actually happened. I mean, I'm not stupid, but that forum was quite horrific.
Well, it sounds it, and it sounds like you guys are really helping to improve people's access to it.
It's a really good thing that they're doing.
Yeah. Thank you so much for telling us all about it. Apologies we don't have more time. I could talk to you forever, but thank you very much for coming in to see us tonight on The 7. Thank you.
Thank you very much.
Thank you.